global model age standardized prevalence of daily tobacco smoking in the population older than 15 years decreased from 41.2% in 1980 to 31.1% in 2012 for men and from 10.6% to 6.2% for women. Global model prevalence declined at a faster rate from 1996 to 2006, compared with the subsequent period. Despite the decline in model prevalence, the number of daily smokers increased from 721 million in 1980 to 967 million to 989 million in 2012. Model prevalence rates exhibited substantial variation across age, sex, and countries, with rate below 5% for women in some African countries, to more than 55% for men in Timor-Leste and Indonesia. The number of cigarettes per smoker per day also varied widely across countries and was not correlated with model prevalence. Pulmonary neuroendocrine cells, including neuroepithelial bodies, are amine and peptide producing cells that function as hypercapnia-sensitive chemoreceptors that could be involved in the pathophysiology of sudden infant death syndromes. Lung is constantly exposed to environment as atmospheric cues. How it senses and responds to these cues is poorly defined. Roundabout receptors genes are expressed in pulmonary neuroendocrine cells, a rare, innervated epithelial population. Robo-inactivation in mouse lung results in an inability to cluster into sensory organoids and triggers increased neuropeptide production upon exposure to air. Lung cancer screening prompted mass current smokers to reflect for the first time on what smoking means for their current and future health. However, 17 of 35 participants described mechanisms whereby screening lowered their motivation for cessation, including the perception that undergoing an imaging test yields the same health benefits as smoking cessation. Other misperceptions include the belief that everyone who participates in screening will benefit. The belief that screening and being able to return for additional screening offers protection from lung cancer. The perception by some individuals that findings from screenings have saved their lives by catching their cancer early when indeterminate findings are identified that can be monitored rather than immediately treated. And a reinforced belief in some individuals that a cancer-free screening test result indicates that they are among the lucky ones who will avoid the harms of smoking. Rates of cigar smoking are rising among both adults and adolescents. Smoking cigars instead of cigarettes does not reduce the risk of nicotine addiction, as the number of cigars smoked and the amount of smoke inhaled increases. The risk of death related to cigar smoking approaches that of cigarette smoking. Cigar smoke contains higher concentration of toxic and carcinogenic compounds than cigarettes and is a major source of fine particle and carbon monoxide indoor air pollution. And cigar smoking is known to cause cancer of the lung and upper aerodigestive tract. My report concludes that the use of products containing nicotine poses dangers to young people, pregnant women, and fetuses. Most e-cigarettes contain nicotine, a highly addictive substance. Nicotine can cross the placenta and can result in multiple adverse consequences, including sudden infant death syndrome, altered corpus callosum, deficit in auditory processing, and obesity. The adolescent brain is also particularly vulnerable to adverse effects of nicotine exposure, including addiction, deficits in learning and attention, reduced impulse control, mood disorder, and priming for use of addictive substance given these effects. The use of products containing nicotine in any form among youth, including the e-cigarettes, is unsafe. Moreover, the potential harms of e-cigarettes among young people extends beyond the user. In addition to nicotine, the aerosol produced by e-cigarettes can contain harmful ingredients, including flavorants and solvents. The situation is compounded by the fact that e-cigarettes or vape products can be used as a delivery system for cannabinoids, alcohol, and other substances. Study findings suggest that such exposure delivers a priming dose of nicotine to the brain that contributes to continued cigarette use in smokers. This study has implications for both biological research into the link between exposure in cigarettes use in public regarding the need to limit the exposure in cars and other enclosed spaces. Despite substantial progress in tobacco control, secondhand smoke exposure remains prevalent worldwide, where the home and other enclosed spaces are the predominant location for such exposure. Secondhand smoke is reported to be more toxic than mainstream cigarette smoke and causes diseases and premature death in children and adults who do not smoke. Exposure to cigarette is associated with sudden infant death syndrome, low infant birth weight, chronic middle ear infection, and respiratory disease in children, as well as cancer and coronary heart disease in adults. Most smokers want to quit smoking but try to stop without using tobacco cessation treatment because abundant evidence supports the efficacy of behavioral, pharmacologic, and combination treatment for tobacco dependence. It is important to increase the proportion of smokers who take advantage of therapy. Evidence confirms that current tobacco treatment models that rely on the patient or clinician to initiate treatment fail to reach all smokers interested in quitting. Proactive outreach strategies are increasingly being evaluated as a systematic approach to engage hard-to-reach smokers to increase the use of evidence-based tobacco treatments. Due to multiple pathway presence in our cell tissue and organs, smoking and even other forms of substance misuse is very hard to dismiss. In smokers, a similar epithelial change occurs initially. The cilia or ciliated cells lose their synchronous beating patterns as a result of noxious elements in smoke. As a result, removal of mucus is impaired. To compensate, the individual begins to cough, thereby facilitating the expulsion of accumulated mucus in the airway, particularly in the trachea. With time, the number of ciliated cells decreases because of chronic coughing. This reduction in ciliated cells further impairs the normal epithelium and results in its replacement with stratified squamous epithelium at affected sites in the airway. If factors that predispose to squamous metaplasia are not eliminated, the metaplastic epithelium may undergo malignant transformation. Therefore, one of the two most common forms of cancer in the respiratory tract, the squamous cell carcinoma, has its origin from the squamous metaplastic cells. Emphysema is a condition of the lung characterized by permanent enlargement of the air spaces distal to the terminal bronchiole. This enlargement is caused by chronic obstruction of airflow, most often because of narrowing of the bronchioles, and is accompanied by the destruction of alveolar wall. Thus, significant area for gas exchange is lost in this disease. Emphysema is relatively common, and it is seen in about half of autopsies and is easily recognized. Pathologists identify several types of emphysema. The severity of the disease is clinically more important, however, than recognition of the specific type. Emphysema is often caused by chronic inhalation of foreign particulate materials such as coal, dust, textile fibers, and construction dust. The most common cause, however, is cigarette smoking. Carboxyhemoglobin increases the risk of blood clot. Carbon monoxide, because of its polar property, significantly different to carbon dioxide, as carbon dioxide is nonpolar. It is thought that through this mechanism, smoking increases the risk of having cardiovascular diseases, especially atherosclerosis and several more diseases in the body systems. Respiratory system, fitness impaired, breathless, cancer, asthma antagonize, damage to cilia, carbon monoxide poisoning and irritation to the trachea, cardiovascular system, artery constriction, high BP, increase in heart rate placing pressure on the heart, reduced amount of oxygen that reaches body tissues and stimulate the blood to clot, digestive system, heartburn, peptic ulcer, gastroesophageal reflux disease, an increased risk of Crohn's disease and pancreatitis, renal system, reduced urine output, an increase in blood pressure making it harder to filter the blood, reproductive system, cervical, breast, testicular, prostate, SIDS, infertility and miscarriage, musculoskeletal system, osteoporosis. Okay, so say no to cigarettes and e-cigarettes. This is Timmy Art 1 year. Thank you for watching.